Welcome back, everyone, to Open Line. Let's go right back to the phones. We're going to go to Sandra now. She has a question for Dr. David Aronoff with Vanderbilt, talking COVID, the variant, all of that. So, Sandra, are you there?
Yes, I am.
All right.
Can you hear me?
Yes, ma'am. Go right ahead.
Okay. I'm wondering, this seems to be a stressful time for a lot of people, and the virus, to some extent or degree, is creating a domino effect. You know, it's affecting all aspects of living, and as a matter of fact, it has personally, indirectly affected my living. I'm just wondering, what does external stress have any effect on how the vaccine will function, you know, in terms of protecting you from the virus itself? Does external stress play a role in that?
That's a good question.
And so weaken your immune system that the vaccine will have little effect on overcoming the virus?
Well, let's ask that. Thank you, Sandra.
Oh.
A lot of people under stress. What impact might that have?
Sandra, that's a really sophisticated question, because I think we all know that being under stress increases the risk for a host of illnesses. And many of us have times in our lives where we can clearly remember we were under a lot of stress and then got sick. And the linkage between our emotional and psychological stress level and our immunity is becoming something that is really under a lot of active study and increasingly understood. Unfortunately, we really don't have a lot of information about how individual stress affects an individual person's response to the vaccines. And that's particularly true for the COVID vaccines. We really don't know. That said, having emotional stress puts people in a situation where they could be more likely to get more sick if they get COVID. And so I think one of the points that your question alludes to is how do we keep people healthy during this time of stress? And part of it is recognizing that psychological and emotional well-being are really, really important. And that's been particularly important for people who are working in the community, people who are frontline healthcare workers who are under a lot of stress. And so we focus a lot on self-care during this pandemic. And I hope, Sandra, that you're able to engage in self-care, that people listening are doing what they can to reduce stress in their lives, because even if we don't know that there's a direct link between stress and response to immunity to the vaccines, we do know that stress can cause harm in lots of other ways. So thank you for bringing that up. I wish I had a more concrete answer for you.
All right, we have 30 seconds left. What is the bottom line takeaway? What do you want people to take away from all of this?
Get vaccinated. The vaccines are really safe and really effective. And while we don't know for sure that they will provide the same protection against Omicron that they have against Delta or other variants, they likely will give us an edge. And during this pandemic, that's what we need, are all the edges we can get. Stack as many cards in our favor as we can. Get your flu shots. Continue to do what you need to do to keep yourself and those around you safe.
Thank you so much for coming on. And we should add, you're moving. So good luck to you and your family. And thank you so much for coming on. You're going up to Indiana, and we wish you all the best up there. But thank you so much for coming on.
Thank you, Ben, for having me. What an honor.
All right. We will be back. I'll wrap everything up right after this.